Welcome back. So the next session is past EU Council Presidencies panel. I'm going to quickly introduce you to the moderator. Tapani is a distinguished civil servant in international healthcare. He has a degree in public health, and his career includes working in the Finnish Ministry of Social Affairs and Healthcare, 6 years at WHO, 14 years at the European Commission as head of unit, where he was responsible for digital transformation, European reference networks, the directive on patient rights in cross-border healthcare, and policies on health technology assessment. He has been a good friend to the ECH Alliance over many years, and last year started our first look back at past presidencies of the Council of the European Union, starting with Ireland, Estonia, Germany, and Portugal. The Digital Health Society has worked with a number of presidencies, and we are keen to see the role developed to improve healthcare for European citizens and the European health data space become a real success. Tapani, over to you.
Thank you for your kind words. And indeed, this is the second in the series of panels on the European Union presidencies. While we are focusing on the digital health and data policies, obviously, whatever we speak about the role of presidencies, it applies to many sectors. But because I know that among the audience, there are many people who are from all over the world, you may not be so familiar. What does this presidency of the European Union or the Council of the European Union actually means? In the European Union, there's a carefully balanced management of the policy making between several actors. Most of you are familiar with the Commission, the EU executive, which is making proposals, implementing the policies. But whenever the Commission makes a policy proposal, proposes a law, there are two actors, the Council of the European Union and the Parliament, who are then taking the decisions on those legal proposals. The Council of the European Union is actually where the member states are coming together. For example, health ministers are meeting regularly together to discuss and decide, but then they are working together with the European Parliament, which is directly elected. The Council itself is led by a member state, each one in turn for 6 months, the spring season or the autumn season. And for the member states, the Council is the main policy setting tool. And today we are going to discuss that how this policy setting is functioning. When the member state has the presidency for 6 months, it seeks to put its ideas on the EU's policy agenda and drive them forward. And at the same time, while for these 6 months, it's an honest broker between the 27 member states and also working closely with the Commission. So today, we are going to hear the successes from presidencies of France, Croatia, and Finland. And we are going to discuss how as a special question, that what would be the advice of the past presidencies for the future presidencies? What should they do regarding the European health data space? We have excellent panelists here, 3 people from 3 presidencies. And I would like you to tell the audience that when was your presidency, how long time ago? But I would first like to introduce you, Hrvoje Belani. You are the head of e-health and cybersecurity at the Ministry of Health in Croatia. When was your presidency?
Hello, Tapani. Thank you very much. It was my pleasure to be here with you. The Croatian presidency was held from January 1st to June 30th back in 2020, just after Finland and before Germany. That was
Thank you.
Thank you.
So 1 year and a half ago. Then we have Isabel Zablit-Smith. You are the Europe and International Director at the Ministerial Delegation for Digital Health, Ministry of Health and Prevention in France. When was your presidency?
Thank you, Tapani, and it's an honor to be together with you today. Well, basically, we are just recovering, I would say, from the presidency because it was, in fact, last spring. So we are still in the recovering phase from that magic moment in time.
Thank you. And our third panelist is Päivi Sillanauke. For the moment, you're the Ambassador for Health and Well-being at the Ministry of Foreign Affairs of Finland. But at the time of the Finnish presidency, you worked as a permanent secretary. So when was the Finnish presidency when you were directing it?
Thank you, Tapani. Very excited to be here with all of you. The Finnish presidency was autumn 2019, so it was before my dear panelists' countries' presidencies, but not so long ago.
Thank you. That was so. Then now you can have an idea that what kind of time span we are discussing. But I would like now to start the first question to Isabel. You still have fresh memories of the French presidency. Can you tell the audience that what, in your view, were the best achievements of the French presidency and what might have been the reasons behind the successes?
Well,
you are muted.
Yeah, I did unmute now. Yes, well, in fact, when looking at those 6 months ahead of the time we started, it was kind of a bit stressful because 6 months is a very limited period of time. So you need to take this into consideration. We had a strategy that was basically based on one key element, supporting the building of European health data space and I would say at the same time of the digital single market for health. So having said that, we recognized very quickly that there was one key missing piece of the puzzle to make it happen. In fact, you cannot work on over the long run in digital health without 3 pillars, which are interoperability, security or cyber security, and ethics. And for this last piece, we had basically nothing or almost nothing. I would say almost nothing because actually we based our work also on the outcome of the Finnish presidencies, which started working on ethics at the time. But unfortunately, this topic was not catch up, afterwards. And then we came back on it. And why was it a success? First, because due to we had also the presidential campaign in France, and due to that, we had a very limited time frame to make it happen. We had just 1 month, 1 month to agree on ethics values for digital health in Europe. And it was a success because in less than a month, we did agree, we adopted 16 principles, ethical European principles for digital health. And more than that, the Ministry of Health of the countries also engaged also for us. So in that sense, it was a success because we established this basis for trust, for the trust of citizens, and in a very limited time frame, because I mean, everybody told us it's impossible in less than a month to agree on that. And the success was that not only that it happened, but also that it was unanimously adopted by all member states and the Commission. And more than that, that the fact that the Commission did in fact include the principles in the proposal for the European Health Data Space regulation. So that was, I would say, a key moment during our presidency.
So you have basically 2 successes. That first one was that you got the other member states on board, and then even the Commission introduced introduce them into the legal proposal. Was that more than you expected, or did you, of course you hoped for that, but was it a pleasant surprise?
Well, in fact, we had it was possible because we had a lot of conversation around ethics while creating the European digital COVID certificate. There was nothing formalized, but we had this feeling that we were sharing some of those values that will influence afterwards the architecture and the way that you position projects in digital health. So we had this basis, and that was extremely important. Of course, we worked also on other topics regarding the establishment of the digital single markets, as I said, notably on working on interoperability with Nomad City and working on the harmonization of evaluation criteria for clinical studies for digital medical devices, and also in proposing to use what was at the time a national platform to speed up the market access of innovators in digital health called Genius, and make it an international platform with the same level of services for all entrepreneurs across Europe. What does it make? It's just that it's a shortcut to find all relevant information that you have to go through while launching an innovation in digital health. It's a very short description, but it's about that. And we have launched already 10 European countries that are live on that platform, and our intention is to cover over by probably not yet by the end of 2022, but in the first trimester of 2023, we go on with that task in order to cover the entire union. And after that, we'll go to other countries as well who have already requested to be on board.
Thank you. Of course, France was very experienced presidents. You have had plenty of them. But then I would like to move over to Horvoje, who you had the first ever Croatian presidency. And when the presidency started in extraordinary circumstances, the COVID-19 pandemic broke out. Tell us something that how did you cope with the situation? It must have been a shock for everybody around, and because so many expectations were around the presidency.
Yes, thank you, Tapani. So it was indeed our first presidency, and I think we were even moved ahead of the schedule because of Brexit. And we were really ambitious in setting the goals and priorities for the presidency. There was a slogan said, a strong Europe in the world of challenges. And if you remember, beginning of 2020, it really was immediately challenged by the whole situation globally. During our presidency, the COVID-19 pandemic has been declared by the WHO. I already mentioned Brexit already, and many challenges in terms of maintaining and actually gaining efficiency in council's work. So we actually set up and had our first digital presidency. So from the council meeting to the ministerial meetings to the expert level meetings, we somehow introduced and established video conferences as a standard for these kind of meetings also. Some of the presidency's achievements, let's say at the political level, were setting up the joint crisis response mechanisms, the Zagreb summit, which also introduced Zagreb declaration with some Western Balkan partners also on board, and also agreement on the Council's position on the Conference of the Future of Europe, many progress on EU strategic agenda in the number of areas. So moving to the virtual space and challenging all those when in these all challenging times during the COVID pandemic, it was really early time of COVID pandemic where there were many unknown things that we had to deal with as other health systems around Europe. I think we managed it successfully There are also some, from the digital health perspective, some unsuccessful points I would like to share with you. So we have worked tirelessly for months to organize the eHealth Week in April 2020, and we sadly we had to cancel this multi-event that actually we planned together all from ministerial to expert levels meetings, eHealth network meetings, and also vendors and governmental bodies. And we sadly we had to cancel that, but nevertheless we joined the eHealth network coordinated actions and worked, as Isabel already said, in 2020 in COVID contact warning apps, and as well as in 2021 EU digital COVID certificates implementation. So this is in brief what we had to challenge, and I think we managed somehow. We grew from that experience, and we see the benefits of this intensive cooperation today.
Thank you for those honest reflections. You mentioned that you were the first digital presidency, something I was dreaming of in 1999 when I was with the Finnish government running the Finnish first presidency. Can you say a few words about that? How did the other member states then react to this digitalization of council meetings?
Of course, with each of the digital transformation efforts, there were some hiccups, of course, but I think everybody got on board quickly and joined this initiative because they realized from the surroundings that we have to be executive and make decisions efficiently. This was really high quality surrounding to work in. So virtual meetings were just started to be a standard for all levels of meetings from then.
Thank you. I'm just checking with the organizers that we don't have yet any questions from the audience. So, and the message for the audience is that you can send questions in, and we try to pick them up once the discussion goes ahead. But then I would like to turn on to Päivi. The Finnish presidency, the last one, the 2019, had a few focus areas in health. Two of them were well-being economy and silver economy. Can you say a few words about what do those terms mean, and how they are linked together, and are they linked to the EU's digital agenda?
Thank you, Tapani. When we had our EU presidency, then autumn 2019, we didn't know that what was ahead. So during the next presidency, we had the COVID-19 outbreak. But I think that it was really up-to-date discussion and dialogue we began then during our presidency, because then we wanted to generate dialogue on the interaction of people's well-being and economic growth. And the Silver Economy Forum, which was actually the biggest meeting, and it was global, not only EU, but it was a global meeting, a high-level forum on silver economy, was then under that theme, and it was then focused on a positive attitude towards longevity and how we can then develop policies that take into account then the aging population and their potential, and then also the technological development that is needed for them to be active members in the society. And the Silver Economy Forum was then a big public-private policy forum where we also studied and learned a lot on how public and private sectors can work. And technology was then really involved into that forum. We had both a digitalization of health services, but also then the potential that robotics and AI have then and could have then. And there were startups and private sector and also academic society participating those dialogues. And we had more than 70 speakers around the world then, and there were a very high level participation also from different finance ministries, but also global banks like Bank of America and then World Bank and Finnish Bank was also one of the organizers there. So we had their Ministry of Finance, Ministry of Social Affairs and Health, Bank of Finland, and then a finance sector from Finland, the 4 different organizers. So it was like a multi-sectoral and multi-partner forum also, if we think about the organizing these kind of forums. And there's a lot to learn when you have a multi-sectoral, multi-partner collaboration. And that was something that is actually, Finland is known about the quite low threshold multi-sectoral collaboration, and that was then why we focused on very systematic work to begin, very systematic work on economy of well-being, the understanding, and then the framework inside which we can then do policy inside EU. And the economy of well-being, it is the very central component of economy of well-being is actually creation of environment that enables people to reach their full potential and to enjoy their fundamental rights. And these are really well related to the global discussion about Agenda 2030, but also what we heard from previous speakers here about ethics, and then about inclusiveness of people. And the things that are involved under this economy of well-being are then cross-sectoral collaboration, health, education, employment, new working life, and well-being at work, gender equality, how technology benefits people's well-being. So very broad framework. And that is actually what we have to keep in our minds, to try to have different aspects when we talk about health and well-being, and that economy is part of that, a sustainable economy and economic growth. And we succeeded to then have council conclusions of this. So we have agreed on a framework so that we have council conclusions, and the social policy, health, consumer affairs, Unemployment Council, and we call it EPSCO here in EU, was then the one under which this council conclusions was then agreed on. So I think that we then built basis for the dialogue that then had to be there when COVID came, and we had tools already there. We had proposed European Health Data Space, and I was so happy and thankful for France that we could get through then also the proposal from Commission. One success for the economic well-being is also that WHO then founded a council on the Economics of Health for All, and Maria Mazzucato is chairing that. And our Prime Minister, because we launched that economy of well-being, then the global WHO then took our Prime Minister as patron for that council. And then also the WHO Europe then established after when we had COVID-19 then 2020, and then WHO Euro, which we have there 53 countries in that organization. They established Pan-European Commission on Health and Sustainable Development, and Mario Monti from Italy is then chairing that. And there were retired politicians, and our previous president was one of the members there. And there again we had possibility then to go the discussion of how economics and sustainable growth and digitalization, gender equality, and things beyond health services are then included together.
Thank you. Thank you, Päivi. I think that you very nicely showed how the linkages between different sectors are important in digital. And being myself from Finland, I perhaps in Finland we think digital as part of everyday life. It's not anymore a separate sector. But I have actually a question here from the audience, and it goes to Isabel. There was one of the listeners was interested. You mentioned the principles which were adopted during the French presidency, and now the audience wants to say that it is a positive step to adopt the principles. Now we are missing how to translate them the principles into actual support from citizens. So how are you working on how to translate the principles into action and bring them to the citizens?
Well, this is indeed a challenge, and of course we gave some visibility to these principles from start, because on the 2nd of February we had a major, still online unfortunately, conference, a ministerial conference, where we went into the details with a full-day conference over those principles with a lot of experts, which did a very excellent contribution to that day, and the ministers of health engaging on the implementation. As I said, we are not satisfied with a text, which is probably a new kind of text also for Europe, because it's a one-pager with 16 principles written in a direct language. And I can tell you frankly that in terms of negotiation, it's even more difficult to achieve that. There's something very crispy and short than a long text. And part of those principles is, of course, the role of the citizen, the fact that the citizen is involved in the governance of health, the fact that the citizen has several rights. So we have 4 dimensions in the principles, and they are all linked to the citizen rights, and the principles were divided in 4 dimensions, and the fourth one, I would say, was also pretty new for most countries, because it's about eco-responsibility, which is also a concern, because if we promote digital health implementation, we need also to be aware of the fact that digital health can pollute the planet. And so we need also to base our ethics on this awareness of we cannot have a side effect that are counterproductive for health. So that would be absurd. And therefore it's about that. So to come back to the question, of course, the role of citizen is at the core of this initiative.
And now in the implementation steps, we have several steps to make. First of all, we worked very hard on explaining in many details and reflect on the use cases of the various principles in each country, because each country has its own experiences, and we wanted to share those best practices and experience among the countries. This document, which is an explanatory one and with those use cases, is about to be issued at European level. So it was a post-presidency homework still to do. And we engage also on further steps. Part of the steps will be communication up to the citizens. So to answer also the question, how do you gain visibility on that? And also, of course, each national roadmap will have to take this into account. We also developed a self-assessment tool, which can already be used and has been used by most European countries in order to assess where each country is, knowing that no country is meeting all the 16 principles compliance, but this is not a problem. We are putting ourselves on a virtuous improvement circle curve. So that's why we thought that it would be great to move forward with implementation. And more than that, the Commission is preparing also an initiative in with capacity building in order to implement those principles in real life. So you see, there is a bulk, I would say, of activities that are part of our action plan of implementation. And we do hope there will be a communication about that done at European level. However, already during the French presidency, not only during the ministerial conference that I was referring to, that was held on the 2nd of February 2022, but in many other events that we did organize during the French presidency, we did reflect on those principles, because of course it's important that everybody is aware of that. And by the way, if you are part of an official digital health, I would say, body in your country, please link to me, because we made huge posters with the principles and we are happy to send them to you in order to be used. Thank you.
Thank you for that offer. And I give a very short and quick comment to Päivi, and then I have a second question from the audience to Horvoje. But Päivi, please, a quick comment.
Yeah, quick comment. It's really important that we get everyone on board now when the Commission have the proposal of European Health Database. And the presidencies after Finnish presidency have done excellent work. And now everyone here in the audience, or there in audience, as we just heard from the French panelist here, that you could be active there and then organize forums or meetings where people can discuss about what this digitalization means and what the proposal actually for secondary use of the health data means, because politicians can't actually do decisions and agree on these if people don't understand what that means. And then we can the Europe can really be that research and development can't continue in our region here if we don't enable the data here be available for personalized care and better medicines, but also more solutions that are developed using new technology and robotics, for example. So the dialogue is really important, and everyone should be involved into that. Thank you.
this digital inclusion is one of the principles in the French ethical principle, obviously. And actually, the next question is that it's a question of digital health, and this goes for Horvoje. In a resource limited setting, conflict and disaster zones, or regions of poor internet accessibility, how does this digital health work? I understand that Croatia is one of those countries which are starting to get the benefits from the EU, but how do you see digital and digitalization in your country? Can you make use of it?
Yes, of course. Thank you for your question. So Croatia is, I think, small enough of a country to have set up centralized e-health platform to support the healthcare processes from primary to secondary to tertiary level of care. So in that sense, we have set up the system pretty early. It began to develop in early 2000s, and now I think it's pretty much developed. But of course, many challenges also lie ahead. Anyway, we have some rural areas, some distant islands that are always a challenge to provide us the same high quality level of care to those points. So sometimes digital health and sometimes other technologies also can contribute. I don't know, for example, buying the fast boats for the islands and buying or setting up the mobile ambulances to rural areas that will actually travel around those with the connectivity, internet connectivity they should also have from those moving vehicles in order to enter the data and to process the data from patients in a proper way. So I think it's not always a matter of technology. It's also a matter of organization in the first place. And if you have set up the proper legal and organizational framework, then you can actually make the maximum use of technologies. We don't have in Croatia, we don't have the drones, but I've read about the successful stories of using drones in Sweden, I think. So yeah, these are the solutions we are really looking forward to in order to help in any way to the patients that need emergent help.
The drones are linked to what Päivi was mentioning, robotics, exactly. And how they help well-being economy. Now, we are coming to an end of our panel, but we still have time for one quick round of your advice. Now, you have told about what you have learned during your presidencies, and now there's a major challenge. Isabel told us that the European health data space was one of big things for their presidency. Päivi said that Finland was involved in promoting the concept. Now, what would be your advice, 30-second advice to the future presidencies, what they should do in order to promote the European health data space, or any other ideas they would like to do? And let's take from the reverse order. So we start with Päivi, that what would be your advice to the next presidencies?
Thank you. I think that the European health data space proposal and agreeing on that is really essential. And therefore, my advice would be that share experiences from already those countries. And I think that in every country we have good experiences on what that means, and not only focus on the privacy issues, but also what the potential is. And that there would be then understanding that without giving the permission for the health data, and we have good rules then that could, and also ways of ensuring the privacy. We have the secondary use of the data legislation in Finland already, so we can show that it is possible, so that we can then build the trust, but from the people, but also understanding that what we could achieve on then having that framework in Europe.
So the emphasis on positive.
Yes.
Thank
what would your advice to the next presidencies?
you very much. If I look back at our presidency and back in the September of 2020, we set up an online event and actually made an effort with the other 10 countries to provide the document called the Building Survival e-health Strategy During Crisis. So this is what we have learned and other countries have learned, and we shaped that into 11 recommendations and really wanted to make an actionable document out of it. So I really want to see more actionable documents as a result of presidencies. Of course, there is enormous effort put in the council conclusions, and I really want more synergy in that sense for these documents that are produced during the presidencies to be exploited furtherly in a positive sense, of course, to be built up upon them. So there is in terms of European health data space, there is a need for continuous collaborative and interdisciplinary cooperation among all levels of policy, from policy to expertise. Of course, member states, but also third countries. We've seen successful joint cooperation with third countries when introducing EU digital COVID certificates. And there's also, there should always be a link towards global organizations like WHO, OECD, etc., because we can really learn from each other in that way. Thank you.
Thank you, Arvaje. The actionable document, I like that expression. Isabel, you're the most fresh advice.
Well, first of all, make concrete steps, and second, don't think it's impossible. That are my key messages to move forward. So it's a lot of optimism also, but this is how we collectively build something. And do not forget that digital health is the only way for Europe to make a Europe of health. So we are the connecting dots of every single other program in Europe. And unfortunately, I still believe there is too few visibility about what can digital health help achieve and what we have already successfully achieved. So this is the main reason why.
By the way, we organized so many events during the French presidency. At the end, we organized 25 events in 6 months, and not because we are crazy, but because we recognize this lack of visibility. And at the same time, we are very much aware of the fact that we, so to say, in silence, in our hidden technical works, we do support the Europe for Health. And during the crisis, I mean, everybody was relying on us to move forward. So this is a proof, so to say, that what I'm saying is not just something exotic, but this is our future. This is our reality already. But we need to make it happen, and only concrete steps help supporting this vision, and only having the conviction that we can collectively achieve it, make it happen.
Thank you very much for your wisdom and deep insights. There's so many things I could instant repeat and conclude, but I have only two conclusions. The first, which is coming from many of your interventions, is that the presidencies, they have to nurture the ideas they are putting forward during the presidency, because the presidencies are too far away from each other, too far apart, so it's many years between. But the presidencies can continue working on the ideas, like Finland on well-being economy, like France on ethical principles. And what helps there is a teaming of presidencies and cooperation between member states, like France and Finland have been doing during their presidencies, and Finland and Croatia. I know that we also work together before your presidency and during your presidency. The second thing regarding the advice on the European health data space is that the work will continue over many years, and many presidencies to come need to work on it and to make it happen. That's all for this panel. Many thanks for excellent panelists, and I give over to the Ledin. Over to you.
Tapani, thank you, and thank you for the panel. Fantastic opportunity for people to hear about the work of the presidencies firsthand and getting your messages across to everyone involved in healthcare. So thank you very much. And with that, we're going to go to a break. And if I can ask you to come back in 8 minutes, so it's a quick comfort break. So if you can come back at 1400 CET, I would be grateful. Thank you very much.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Goodbye.